Septic arthritis is a joint infection that makes the joint hot, swollen, and painful. Think of a joint like a hinge on a door. When germs get into the hinge, the door cannot move smoothly and may even get stuck. The infection usually comes from bacteria that travel in the blood from another part of the body, like a skin cut or a urinary tract infection. In children, the most common bug is Staphylococcus aureus. Injuries that break the skin, injections, or even a recent surgery can also let germs into the joint. Typical signs are sudden joint pain, swelling, redness, and fever. For example, a child might refuse to walk because his knee hurts, or an adult might notice that the elbow feels hot and stiff after a minor fall. The joint often becomes so painful that simply moving it feels like a sharp sting. Doctors check blood tests for infection, use an ultrasound or X-ray to see fluid, and most importantly, take a sample of joint fluid with a needle, arthrocentesis. The fluid is sent to the lab to identify the bacteria. Treatment starts with strong IV antibiotics, often for 2 to 4 weeks, and sometimes surgery to wash out the joint if the infection is severe. You can lower the risk by keeping cuts clean, treating any skin infections promptly, using sterile technique for any joint injections, and controlling chronic diseases such as diabetes. Good hand washing and covering wounds also help keep germs out of the bloodstream. Recent advances include rapid molecular tests that can identify the bacteria in joint fluid within a few hours, allowing doctors to choose the right antibiotic faster.